From updates to RSV to air quality worries, there's been a lot of health concerns making headlines this week. Here to answer your questions, this is rare to have you on a Friday, Dr. Todd Ellerin, the Chief of Infectious Diseases at South Shore Health. Always great to see you, Doctor.
You too.
Thanks for being with us. You know, we've all seen the smoke that's moving up and down the East Coast this week from those wildfires in Canada. Well, a lot of people have suffered symptoms from the dangerous air quality levels. I know for me, I'm very sensitive to it. The nose, the eyes, all affected. What was the impact that you and your colleagues saw at South Shore Health? And with climate change, what's the lesson going forward when we might see more of these huge wildfires?
What we're seeing is so important, Jessica. Locally, we think we have seen a few cases that were likely due to wildfires. Obviously, when people have asthma or COPD exacerbations, sometimes it's hard to pin down exactly what it's from. But what can we do about this? Remember, this is something that's occurred because of the dry weather, the hot heat. The fact of the matter is we're going to see more of this. And so what do we have to do? We need to be proactive as far as prevention and mitigation efforts against wildfires. Importantly, we have to invest in fire prevention and suppressive measures like the controlled burns. Early detection is so important. Of course, we know what's at the root cause of this, global warming and climate change. That is what we really have to try to combat. Also, this really highlights how important emergency response and evacuation efforts is. We are going to see more of this. We have to be prepared.
Yep, absolutely. Another health concern making headlines this week, RSV again. We heard a lot about it this past winter. A lot of kids, a lot of seniors getting sick from it. There have been some developments with vaccines for both older adults and kids. Get us caught up with the developments.
Maria, let's face it. RSV is in trouble next season. Why is that? Just yesterday, what happened was the FDA, their advisory committee, authorized a monoclonal antibody to be given to newborns and at-risk young children. And what that's going to do is significantly decrease the amount of severe RSV. This monoclonal antibody decreased the likelihood of needing medical visits to their pediatricians or emergency room visits by between 70 and 80%. So that's very good news. We also just recently heard that a vaccine to be given to pregnant women in their second half of pregnancy, an RSV vaccine that could then prevent the newborns who develop the antibodies, because the antibodies can cross the placenta, that also will likely be FDA approved before the next season. So there's a lot of great things ahead. And again, RSV is in trouble.
Switching now to the coronavirus, there's a new study out there about treatment for long COVID. It says one drug in particular holds some promise. Can you remind everyone about the problem of long COVID and what this study says about it?
Right. Remember, long COVID is real. It probably occurs in somewhere around 10% of patients who get COVID. It hasn't gone away, even with the Omicron variants. What are some of the symptoms? Fatigue, headache, chest pain, feeling like you can't breathe, this brain fog where you can't remember where in the supermarket the regular items are that you're used to. So this study was complicated, but I'm going to simplify it. It was a randomized control study, and it looked at a number of medications versus placebo. One of them was metformin. That's a diabetic medication, but it can have some anti-inflammatory and antiviral properties. So they gave about 1,000 patients metformin in an escalating dose from 500 a day up to 500 in the morning and 1,500 milligrams at night. That was 2 weeks versus placebo. And what it showed was there was a significant decrease in the amount of physician-diagnosed long COVID at 300 days.
Wow.
So that's something. We've seen it with Paxlovid as well in the elderly. So one of the questions is going to be what happens with Paxlovid in addition to metformin. So this is something to consider. One last thing is that this study population was those who are overweight and obese from 30 years and up. So that's the population that you want to consider metformin, especially if you're not being treated with Paxlovid.
Interesting how this continues to evolve.
Yeah. Dr. Ellerin, thank you so much.
Thank you, Doctor. Be well.
Have a great weekend.
Yep, you too. To our viewers, if you have any health-related questions you would like our experts to answer, it's easy. Email them to ask@wcvb.com.